Ever pondered the fact that up to 75% of women will have at least one vaginal yeast infection in their lifetime? This intriguing statistic is where we begin our journey today. Welcome to Edukia Medical, your go-to source for all things medical. A vaginal yeast infection, a type of fungal infection, is caused by a kind of yeast called Candida. Normally, this yeast exists in balance within your body, causing no issues. However, when an imbalance occurs, this yeast grows rapidly, leading to an infection. Vaginal yeast infections are quite common, being the second leading cause of vaginitis. Certain factors can increase your risk of getting a yeast infection. These include the use of antibiotics, birth control pills, certain steroids, being pregnant, having a health condition that weakens your immune system, having unmanaged diabetes, sitting in a wet bathing suit, not changing out of sweaty clothes, and using scented tampons or vaginal deodorants. Symptoms of a vaginal yeast infection can range from an itchy or burning sensation in your vagina and vulva, a thick white vaginal discharge similar to cottage cheese, to redness and swelling of your vagina and vulva, small cuts or tiny cracks in the skin of your vulva due to fragile skin in the area, a burning feeling when you pee, and pain during sex can also be indicators. Diagnosing a yeast infection involves a sample of discharge from the vagina to confirm the presence of yeast. The combination of your symptoms and the discharge sample will provide your healthcare provider with the information needed to determine the type of yeast infection you have and how to treat it. Antifungal medications are the standard treatment for most vaginal yeast infections. These medications, which can be oral or topical, work by fighting the yeast overgrowth in your body. Some common medications include fluconazole, miconazole, and turconazole. It's important to abstain from sex until your treatment is complete. The duration of yeast infections varies. Most clear up with medication after a few days, but it may take up to a week. More severe cases may last longer and require a lengthier treatment period. Remember, a yeast infection can't disappear on its own. Only a medication that destroys fungus will treat a vaginal yeast infection. Preventing yeast infections is possible by not douching, avoiding the use of feminine deodorants, not using scented tampons or pads, changing out of wet clothing as soon as possible, wearing cotton underwear and loose-fitting clothes, using water-based sexual lubricants, and maintaining your blood sugar levels in a normal range if you have diabetes. And there you have it, a comprehensive guide to vaginal yeast infections. From causes, symptoms, and treatments to prevention strategies, we've covered it all. Remember, knowledge is power, and understanding your body is the first step in maintaining your health. Don't forget to like and subscribe to Edukia Medical for more informative videos. Thank you for tuning in.